You're not going to get to healing medically or physically until you understand what matters to you. And we're trying to scale that to understand what matters at the beginning of any interaction. It's not all the tech gadgets and all the advances in medicine, which are huge, and I don't want to diminish that, but kindness heals.
Hello and welcome. I'm Chris Malone, and I'll be your host for today's discussion. Thank you very much for joining us. Before we begin, I would like to welcome Tim Bowen, Director of Client Success Development at PRC. PRC partners with healthcare organizations nationwide to improve the healthcare experience for patients, physicians, and employees by helping leaders turn insight into meaningful improvements in care, culture, and outcomes. Welcome, Tim. What can you tell us about our guest today?
Hey, Chris. Glad to be with everybody today. Looking forward to the conversation. I have the pleasure of introducing our guest, Camille Haycock. Camille is a Senior Vice President and Chief Patient Experience Officer at CommonSpirit Health, one of the largest nonprofit health systems in the United States. In this role, she leads enterprise efforts to embed patient experience into the operational, cultural, and clinical fabric of a national system, serving communities across more than 24 states. A clinician by training, Camille is widely recognized for integrating experience measurement, quality, safety, and operational accountability to improve how care is delivered and experienced by patients and families. Camille's leadership has helped advance a system-wide model that translates patients' insight into measurable improvements in care delivery, aligning frontline practice with the mission of compassionate, human-centered care. Known for combining disciplined use of data with deep empathy for patients and caregivers, Camille continues to champion the idea that human kindness, trust, and connection are essential elements of healing. Camille, welcome to the program.
Thank you, Tim. Thank you, Chris. Delighted to be here. And thank you for the invitation.
We're very pleased to have you. And so to start us off, Camille, we would love to hear the story of how you found your path into a career in healthcare. Was there any particular experience or a moment in particular that led you to that?
We all have personal experiences with healthcare, but my background in quality actually paved the way for patient experience, and to weave the two together has been just a really fulfilling career opportunity for me. Of course, when my elderly father was ill, and I saw the difference that kind and caring caregivers can make a difference in his outcomes, and his day in large really did accelerate my need or my wishes to want to impact this work.
Well, we're glad that you did. You seem to be making a terrific impact, and it was a great choice for the rest of us to benefit from.
Thank you, Chris.
Now, you lead patient experience across one of the largest health systems in the United States. So what does it mean to operationalize human kindness and humanized healthcare at scale?
It's not about metrics. It's not about outcomes. It's about the connection that we have that can make a difference. And caregivers and healthcare in general is in a prime position to be able to influence that. It starts with organizational intent. So right up there at CommonSpirit is our mission, our vision, our values, and organizational intent, which is what we call the strategic positioning statement, meaning that we intend to deliver human kindness at every touch point. How do we do that? That's in the next sentence, through integrated and holistic care experiences. But to get to the bottom of that, you really got to understand what's important to the patient. And that's how we humanize that aspect. Is we're not going to heal medically, if there's something in front of mind that needs to be addressed first.
It sounds like human kindness is right there from the top in the mission statement of the organization as the foundation for everything else that gets done. It's not something that's just an initiative in patient experience. It's right there as the mission for the whole organization, it sounds like. Is that right?
Absolutely. It's not only for patients, but consumers, wanting to have that seamless care delivery, but also super important is how we treat each other, because how we treat each other will, obviously influence how we treat our customers and our patients. There are so many different work streams, addressing this within their functional area. I have patient experience, but it's been really gratifying to see other work streams tackle this as well.
I know that you've emphasized that patient experience efforts need to be integrated with quality and safety. And why, from your perspective, is it so important that experience is not treated as a separate initiative?
My bias is that patient experience will never, if we've got a safety event, that patient's not going to have a good patient experience. Same with any kind of quality outcome. So quality and safety is the patient experience. So you have to look at them integrated to make sure that all the safety events are going down, as well as, our quality indicators are improving, and that will actually lead to a better patient experience as well. It's more than that connection. We know that, adverse events that happen will impact patient experience.
Now, CommonSpirit spans hospitals, clinics, communities across many states. What are the biggest challenges in creating consistent patient experience across such a complex system of organization?
In every single one of our care settings, the data that we use to understand the patient experience is different. So different questions are asked in survey. These are different in different care settings. For example, in an inpatient person in a room versus somebody who's sitting in a reception area in a clinic. Those sorts of different care settings require different approaches to improvement. So we've had to really customize our efforts for whatever care setting it is that we are intending to improve. And we have goals, specific goals in each one of these care settings. We have 5 care settings that are visible to our board with goals. And then we have about 5 others that we also look at in smaller care settings.
And so you're really kind of tailoring it to that environment.
Yes.
And that is how you kind of eat the elephant, if you will, kind of one care environment or one specialized program at a time.
Correct. And we have subject matter experts that are on the national team that support those areas, those care areas, and really refine the practices. Now, how we treat each other and how we treat people, that should be, across all care settings, but the tactics alone are a little bit unique for each care setting. So we have subject matter experts that actually work with the operators in these respective care settings to drive the improvement efforts.
That sounds great. Now, many organizations collect patient feedback, but struggle to translate that into insights and change. How do you ensure that patient experience data actually drives improvement? How do you apply that? How do you translate it?
We have so much data, and somebody told me just the other day that we get 1,600 comments back every single day. So making sense of that and really drilling into insights. Of course, we use a lot of AI to look at our comments to dive insights from them, but the quantitative data that really demonstrate, are we actually improving? So we do both. We look at, the qualitative data as well as the quantitative. And that qualitative data is really enhanced by AI. But what's going to impact that is that human experience at the point of service.
And I heard a story recently, as I mentioned to you before, about one of the CommonSpirit hospitals in Omaha, Nebraska. And it was related to me by someone who had lost her mother and who was in an end-stage cancer state. And that from the time of her diagnosis of stage 4 colon cancer to the time that she passed was only 19 days. But in those 19 days at Emmanuel Hospital in Omaha, the care team was so attentive, so caring, so comforting, not only to her mother, but also to her family, that they would arrange to bring them meals late in the day and so forth. And that when their mother eventually passed 19 days later, they really had formed a relationship with those care providers, despite that they all knew that it was going to be an end-of-life situation. So much so that members of that care team took time off and drove 90 miles each way to her funeral, which I just thought was really touching and shows that even in those instances where we know what the outcome is going to be, that could have been much more traumatic, but in the end, it was much less traumatic because of the comfort they provided. I think it's stories like that that really show human kindness and bring it to life.
And thank you so much, Chris, for highlighting that. This happened at one of our CommonSpirit hospitals out in Nebraska. But what I want to underscore is the relationships that you build. And that is what will be key to building that connection with people that will ultimately leave a lasting imprint and acknowledgement of the services at any given hospital, clinic, home health service, etc. It's relationships, it's connection, but it's really understanding what's important to that patient in that moment. 19 days is not a lot of time to actually make an impact, and it sounds like they did. So yay for Emmanuel.
Absolutely. And as you've said before, that experience that the patient has is deeply connected to the culture and the experience that those caregivers are having. And so I wonder, what have you learned about supporting clinicians and staff so that they can be enabled and empowered to deliver that kind of compassionate care? Anything that you have identified that helps support that?
It's not just clinical staff. I mean, I deal mostly with the operations and the clinical staff, but it's also people that are EVS workers and our housekeepers and the dietary staff. All of these folks have an impact, and they've made an impact, and they continue to want to make a differentiating experience for that patient through human kindness. And we offer this opportunity for them to go to retreats and to learn how to make that connection, how to listen to people, how to truly show empathy, how to, connect on a level that's human versus sitting behind a computer and do what historically has been a very huge part of, that care interaction. So we're really trying to humanize that experience with all of these different ways in which we teach human kindness, respect, how to show respect, empathy, listening, and then just kindness with people. And an unintended consequence is teams love that. I'll bet you those folks that you just described out in Emmanuel, I mean, they would not have driven 90 miles if that had not been important to them. The caregivers want that feeling of they're making a difference. It's teamwork, and it's also just why we went into healthcare to begin with.
And that's exactly what we're hearing to caregivers and clinicians that we talk to, is that those relationships with patients are the emotional fuel that shows them that they are making a difference and brings them to care every day. And as you said, it's the reason they came to healthcare, that even in those instances, which in acute care where we are knowing that, hey, the intention is not for me to have a personally long-lasting relationship with you, but making those connections and being treated in a relational way makes everybody involved feel a lot better about that experience.
It's your fuel. It's what gets you up in the morning, knowing that you can impact somebody. And it doesn't have to be heroics. My tank is filled when I wake up in the morning and see all these things that people are sending me stories. And I just heard one last week that was about 2 leaders rounding on a med-surg unit that understood from talking to the patient that he was extremely stressed. He was a student, and he needed to give a presentation at an accounting class. And they made way for him to do that virtually, borrowed a sports jacket from the president of the hospital, and impacted that patient in such a way that he was getting ready to leave the hospital, because that was what was so important. So understanding what matters to that patient first and foremost in that moment is key. You're not going to get to healing medically or physically until you understand what's important. And I love age-friendly healthcare. I mean, one of the 4 M's is what matters to you. And we're trying to scale that to understand what matters at the beginning of any interaction, what matters to them right now. That is, again, another way to humanize the experience for the patient. It's not all the tech gadgets and all the advances in medicine, which are huge, and I don't want to diminish that, but kindness heals, and we believe that at CommonSpirit.
There is no question about it. And I think that understanding what matters to the patient in that moment is where you get to that personalization of care, right? I don't think any of us wants to be treated like a transaction and that it's a one size fits all. And so taking the time to learn that gives us what we need in order to personalize that experience and make that connection. Now, you began your career as a clinician, and I'm wondering how your clinical background has shaped the way you lead experience transformation. Is it something that gives you a very strong nursing perspective, or has it informed your perspective on all aspects of the care team?
I've had such a diverse career, starting as a nurse and doing lots of different nursing things, but understanding how to lead initiatives at scale, I lean on my background as an advanced practice nurse to really understand how to do that, how to do things at scale with evidence-based practices and standardization. And, early on, just putting standardized order sets together for patients is the first thing we did to standardize care. So learning how to do that and impacting patients at scale, both medically and in nursing, was a great foundation for me to understand how to do things at scale. So that has been, a huge learning experience for me and leadership to be able to influence large populations of the people we serve. And so I think that doing things at scale, I learned that from nursing. And also to rely on a team. That's the other thing that's so huge about nursing is you have to have a team around you. It's a care team. It's not one person. And nurses are so good at teamwork. It takes a care team and everybody in that moment to understand and to take care of that patient or that consumer or that whomever, or each other. And I've also learned from nursing that when you do things as a team, you're taking care of each other. I got you. I got your back. Go take a break. I got you. And so that level of teamwork is what is so necessary. And this happened years ago, but it's still relevant today. The teams and the idea of understanding what's important to that patient and then doing that as a team.
That's a great insight and a great segue to my next question. And that is, experienced leaders often have to influence change without direct authority, right? Operational authority. And I'm wondering what leadership skills are most important in your view for chief patient experience officers. Is teamwork one of them? And if so, what else?
Teamwork is key. And then you've got to have influence and you've got to understand. And I think this, again, I rely on my clinical background for. You have to understand what the challenges are at the bedside in that clinic for credibility's sake, I think. I mean, this is my bias, is that understanding what a short-staffed unit looks like when you've got a charge nurse or a manager, taking a patient assignment because there's nobody else. I mean, you really need to understand how teams work together and all of the challenges that are currently facing our workforce right now and how we can make that better for them and unburden some of that to make them happy again. They got into healthcare because they wanted to make the patients happy and to heal and to unburden some of those challenges. First of all, you have to understand the issues. And I think that that's, to your question, what the background has done for me.
Fantastic. In large systems, culture can vary widely between facilities. How do you kind of build a shared culture of human kindness across such a diverse organization? Any insights on that one?
Yeah, I'm just going to go back to what I started with is organizational intent. You have to have at the top, what is most important to this organization? What is our strategy? Right now, it is that experience. It's called experience, and it's done through human kindness in every interaction. And that statement, our positioning statement, is at the very top of the organization. So there's no question across the organization what's most important and what we want to deliver on. That makes my job easy. I just get to go in with how are we going to do this? I always have the backing of senior leaders to give me kind of rein on what needs to be done.
And that's, I suppose, to your point, it makes the conversation shorter, right? It's not a question if we're going to do human kindness. It's just a question of how we're going to do it.
Right. And patient experience outcomes are at the top of the organization at every board meeting, at, the CommonSpirit board. They're looking at our outcomes. It is every bit as important as quality and safety, financial metrics. It's got that kind of visibility.
Here's another one. Do you feel that to be in patient experience as a career, you need to have a clinical background or education? What are your thoughts on that one?
It's requisite, but I think you've got to understand the challenges. It's easier when you live the challenges, but, if you're a good listener and you can, understand and be aware of what people are facing and work within those parameters. I've seen lots of people outside of clinical that are very successful at driving this work. It takes a good listener and a wealth of emotional intelligence to understand the challenges and how to impact those.
Yeah, I suppose it requires that you have an ability to learn from the experience of others rather than just draw on perhaps your own personal experience as part of the care team.
Correct.
Great. Here's another question from Alicia Stamel Macarenas. She asked, would you say there is a balance between the individual and the organization? The health of one begets and influences the health of the other? What do you think there?
The way I interpret it is the health of the caregiver will influence the health of the patient.
She's suggesting that If the health of the organization is good, it's in a better position to help, the individual, as well as if the health of the individual is in good shape, they're in a better position to support the health of the organization.
100%. Absolutely. And the health of our caregivers. I mean, we've got so many beautiful programs with well-being, and this is led out of our people function, and they've done beautiful work in how to keep our teams healthy. And it's really, everybody is kind of focused on this idea of what you just required, that the health of the caregiver, the health of the individual will impact the health of the patient. Absolutely.
Alicia just confirmed that exactly. She said, in general, happy employees, happy patients. I think we're on the right track.
Yep.
Here we got another question from our friend Kareem Ahmadi. He asks, how much importance does patient throughput carry in improving patient experience? Sometimes those are thought of as being at odds with one another, but what do you think?
Chris, you mentioned at the top of the meeting that, we like to embed experience, tactics, or lack of a better word, into some of these throughput issues. So, for example, I think there's not an ER, a busy ER in any metropolitan city that's not backed up and that's not boarding patients that are waiting for a bed. I mean, that's just the nature across, not just at CommonSpirit, but across all hospitals. I hear about it all the time. But how can we, improve the experience in our emergency departments and embed experience tactics in our reception areas, as well as when they're back in the rooms being seen by providers? So we have a lot of evidence-based practices that we're working with, and we've made so many improvements in our ERs that I'm so proud of. But lately, these patients that are boarding, it is a problem. And that throughput, and nothing is worse for a patient experience than sitting in a hallway waiting for a bed. And this could be for hours. So how do we treat those patients? Well, we are treating them like inpatients, which is what they are. They get hourly rounding and constant observation so that bedside shift report, we're trying to bring these inpatient things that we've been doing for decades, into patients that, quote, boarding in our hallways. And we really try and find privacy for them. It's so difficult. And these teams are challenged. And to not understand the challenge that the operators are dealing with, patient experience will never be successful.
Yeah, I think you make a great point. In our work, we find that time is such a strong indicator. Whether it's respectful use of that time or efficient use of that time is such a strong signal to patients about whether people care about them. And that situations you described, we don't always have control of that, but that time can either amplify their anxiety or their fear or discomfort, what have you, or it can add comfort to it. But I think you're right. It's what we do with the time of connection that we have, even if it's short, to show that we do see you, we do care. We are going to give you that, even if the room is not ready for you yet. We haven't forgotten you, and we want to ameliorate your discomfort.
Beautiful, Chris. Thank you. Couldn't have said it better myself.
Now, I would love to ask you what is our favorite and final question in every episode. And that is, do you have a favorite quote you can share? And if so, why it's your favorite quote?
I do. And that, of course, is Maya Angelou, who's one of my favorites, that says, people will forget what you said and they'll forget what you did, but they will never forget how you made them feel. You led with that with the story at Emmanuel. And it's the caregivers, what they made that family feel like, what they made each other feel like. That's what you'll remember. You're not going to remember the event. You're going to remember the gratitude that was shared, the willingness that you had to extend yourself when somebody was in need. That's what people will remember. And not just the patients, but the caregivers and their families.
It's a great, great point, and one of my favorite quotes as well, because it reinforces that it's not just that we did the task, it's how we did the task and how we made the other person feel about the care that we provided there. Because as you said, it's those emotions that get imprinted on our memory, and that's what stays with us. Yep. And whether that emotion is kind of elevated trauma or sympathetic compassion, makes a big difference in what we take away from that and what relationship can result from it. Yeah. So Camille, I can't thank you enough for another really inspiring and engaging conversation. We're so grateful for the wisdom and great work that you are doing and that you've shared with us. To our listeners, thank you for joining us as well. And be sure to join us for our next episode of Humanizing Healthcare on Thursday, May 14th at 1 p.m. Eastern. We'll be talking with Jason Wolf, President and CEO of the Barrel Institute, as well as the founding editor of the Patient Experience Journal. You won't want to miss it. Thank you again for being part of our community, and a great rest of your day.
Thank you.
Thank you, Camille.